Welcome. My name is Jason Helgerson, and I'm pleased to be here to present the latest in our New York State Whiteboard series. Today's topic, value-based payment and the year ahead. Value-based payment, extremely important topic, major priority of the New York State Health Department, and a major transformation in how healthcare is provided in New York State. The good news today is that our latest version, the second version of the value-based payment roadmap, has been approved by the federal government, by the Centers for Medicare and Medicaid Services. Very exciting initiative, means that we are really ready to go in terms of implementation. Much of the policy development work over the last year to 18 months was reflected in that plan. So it's very exciting for us to have that kind of certainty moving forward into this next phase, which is implementation. Next bit of information to update you on is progress. We are making progress. I'll show you some results from a recent survey, but we are moving the needle relative to the percent of our contracts that are value-based. More and more contracts are getting signed almost every day. We see it not only in the statistics, but we hear about it in anecdotes from providers and plans from all across the state. So we're very excited to see that kind of progress. But as I say, the key thing is there's still work to be done. We have a very aggressive target. It's laid out in our district agreement. Funds, hundreds of millions of dollars linked to that target. That target is 80% of our payments must be value-based by the end of the waiver period, end of this decade. So that is a very steep hill to climb. But as I say, the good news is we are making some progress. So in terms of that progress, we just did a survey, 2015 calendar year, so a little bit in the past. We've been doing these surveys, sort of catching up with our plans to see where we are relative to our value payments objectives. You can see from here the various levels, 1, 2, and 3, as well as what is fee-for-service as of this calendar year, 2015. What I want to note is two things. First off, we are now at about 34% of our payments are value-based. So basically, a little over a third of our payments are already in the VBP category. But also important in finding out of this study was this, that 17%, or actually 16.8% of payments are in level 0. That means they're not yet value-based, but actually are quite close. And if you looked within that, what you'd find is the vast, vast majority, 90+% of those payments that aren't yet into the VBP column, the reason they're not there is because they do not yet have performance metrics tied to it. It's going to be, to make that change, to get in those additional measures is not a heavy lift for providers and plans. So we are excited that this is low-hanging fruit that in essence could be addressed quickly, and we could potentially move that into this VBP column within the next few months. And as a result, we could be at a point where 50% of our payments are value-based. Not yet 80, but as I say, significant progress, significant movement in the right direction. So in terms of themes and things to think about relative to value-based payment going forward, first and foremost, partner, partner, partner. Can't say it enough. It's very difficult for an individual organization on its own, on an island, to be successful in value-based payment. You're talking about trying to better meet the holistic needs of complex individuals who touch many aspects of the healthcare system. It's important for providers to work together, to break down the silos, to see each other as teammates in an effort to better serve the population. And so we're strongly encouraging those partnerships at the local level. Next, more information on our website. We're constantly looking to feed information out there to the field. There's a tremendous thirst for that information. We're actually in the process of redesigning our website and actually creating a portal explicitly for providers to support you in your VBP efforts. Next, boot camps. We ran a series of boot camps last summer, very, very well received by the field. Hundreds of people attended. We're going to do more of those this summer, so there's more information to come. And then lastly, value-based payment is not going away. I know there's a lot of concern out there in the field relative to some of the uncertainty coming out of Washington. We're all monitoring that situation very closely, but a couple of things we do know. First and foremost, the district program is governed by our 1115 waiver, and that was approved under the previous administration, and it will last through the full 2020-21 timeline. Also, this roadmap was just approved by this administration in Washington, the one that is in power now. So that is an indication, a strong indication to us here at the state that the federal government wants New York to move forward and continue to move forward in value-based payment. Those are two important things that strongly suggest that value-based payment is not going anywhere. Remains one of our top priorities, and it's one thing that we're going to be working on very closely. So it's important for all providers and plans to know that continues to be our direction. So thanks. I hope you found this whiteboard video helpful. We look forward to more videos and more conversation on these important topics in the future.